Hello, and welcome to the MedStar Georgetown NIH Neurology Residency Program. My name is Dr. Lakshman Baru. I'm the Residency Program Director and Associate Professor of Neurology, and it is my distinct pleasure to introduce our program to you. The goal of this residency program is to train neurologists as future leaders in neurology. We want our graduates to not only provide compassionate, excellent patient care, but also be scientifically motivated and intellectually curious. Our goal is to train neurologists tomorrow who are not just educators and clinicians, but who really want to advance the care of neurological illness. We believe residents are motivated learners who need guidance. Our program in a nutshell is a categorical program with PGY1 included. We currently have 7 residents per year, 6 clinical scholars and 1 clinician scientist, so that will change as I discuss with you in the next few slides. We have 2 child neurology fellows in their first year of fellowship going through adult neurology that'll rotate through. We are one of the largest neurology residency programs in the Mid-Atlantic. Brief timeline of our program. Our program has been around since 1964. In 2006, we expanded to 7 positions per year. In 2015, we affiliated with the NIH to create our research track called the Clinician Scientist track. It became a categorical program the year after. In 2018, we went through a program refresh to bring our program in line with contemporary neurology. And in 2022, we expanded to 8 residents per year, so that'll be 6 scholar tracked and 2 scientist research tracked individuals. Our program culture is that of a community. We treat residents as part of our family and future colleagues. We are a front-loaded program. You'll see that in our diagram shortly. And we believe in progressive autonomy over training, gradually expanding autonomy from PGY2 to PGY4. We believe our PGY4s are acting attendings. Here's a list of our affiliate hospitals. We have MedStar Georgetown University Hospital, MedStar Washington Hospital Center, the National Institute of Health, and Children's National Medical Center. We'll talk about each of those in the next few slides. Our department is a center of excellence, whether it's for Parkinson's, MS, muscular dystrophy, Lewy body dementia, Huntington's disease. We are an epilepsy center as well as a stroke center. MedStar Georgetown University Hospital is a tertiary care center. It receives referrals from the greater DC area and has active outpatient clinics not only on its main campus, but also satellite clinics. Rotations that residents undergo at MedStar Georgetown University Hospital, the inpatient side has ward service, which is a primary service, stroke service, which is also a primary service, consultation service, and an epilepsy rotation, including the EMU. On the outpatient side, we have subspecialty clinics for our PGY2s and 3s, as well as chief clinic for our PGY4s. During this time, residents rotate through 5 subspecialty clinics, ranging from movement disorders, multiple sclerosis, neuromuscular medicine, neuro-ophthalmology, and headache. This type of broad exposure to subspecialty neurology early on gives residents a view the breadth of neurology and allows them to make choices on how best to focus their interest in neurology. And if they choose to pursue a fellowship, it really gives you an idea of how different subspecialties work and which one attracts your personality best. MedStar Washington Hospital Center is the largest hospital in DC. It is a referral center and an urban hospital serving the population of DC. On the inpatient side, residents will rotate on the consultation service as well as the stroke service. This is the NIH stroke service affiliated with the NIH, folks that are responsible for some of the research and clinical care at Washington Hospital Center, as well as a neurocritical care rotation. On the outpatient side, residents will rotate through continuity clinic through all the years of neurology residency. And there's also a neurophysiology rotation for residents to hone their EMG and EEG skills. Children's National Medical Center is also a tertiary care center. It is one of the largest pediatric departments in the country. And individuals do 3 months of consultation as well as an outpatient rotation during their PGY3 and PGY4 years. The National Institute of Health is, of course, the largest medical institute in the world. Of course, National Institute of Health is its own city located in Bethesda, Maryland. And it's a large institute where residents will rotate through the NINDS when they're part of this rotation during their PGY 4 year. And of course, our clinician scientist individuals will rotate their elective time there, focusing on a dedicated research project. Our hybrid rotation consists of consultation services in the morning, basically being able to see uncommon manifestations of neurological illness or even rare manifestations of neurological illness, and then working through subspecialty clinics in the afternoon gives you an idea of being able to see uncommon and rare presentations at the NIH. There's also elective rotations available, rotating with various individuals at the NIH for the folks in the scholar track. Let's talk a little bit about our two different tracks. The clinician scientist track is our dedicated research track. Individuals have protected research time starting from PGY2, and mentorship starts as early as PGY1. In fact, you are paired with a mentor right after your match. And unlike other research tracks, you are guaranteed funding for your research project. This year, of course, is the first year we're offering 2 residents to be available for this track. We'll talk about that in a few minutes and how that impacts the schedule. The clinician scientist track consists of 26 weeks of research time during their PGY 3 and 4 year. The clinician scientist is a NIH clinical fellow. It's the equivalent of receiving an NINDS R25 grant without having to apply for one. And this allows you to focus on your research track and not on the application process and hoping that your grant gets approved. You have a dedicated program director that manages your research interests and coordinates your research interests with faculty. And the goal is to train a clinician scientist who has an interest in research that goes beyond just residency and well into their career. Graduates of this program have gone on to win research awards, and many of them have gone on to fellowships that incorporate a good amount of research and will have careers where they will have publications in specific projects as well as clinical medicine. There's definitely potential for fellowship training further at the NIH after residency. We have a global health initiative. We have a global health initiative, which has been on hold, unfortunately, due to the pandemic. It's through the Department of Medicine. And our global health initiative involves 1 to 2 residents, typically from the scholar track. They have didactics in their PGY 3 and PGY 4 year, and we have 8 weeks of on-site rotation in Africa. During this time period, of course, the global health initiative has been on hold, but we expect to revive it and to be able to offer it to our individuals in the next year or so. If one were to look at rotations by year, it's important to understand how our program progresses over the course of time to provide gradual autonomy. Our PGY 1 year, the role is to really provide an essential exposure to medicine. We have 16 weeks of neurology, a mixture of inpatient and outpatient, and that is the maximum allowed by the ACGME. During your PGY 2 year, we want to build a strong base in inpatient and outpatient neurology with supervision, not just from attendings, but also from PGY 4 residents. We also believe in early exposure to subspecialty neurology, so you can see what else is out there in neurology, not just focusing on inpatient alone. During your PGY 3 and 4 year, the goal is PGY 3 is to really develop expertise in neurology, to hone in on your interests, using your elective time really to find your interest within neurology, or to allow yourself to be exposed to a variety of different neurological rotations, both inpatient and outpatient. It is also the year of graduated autonomy. We expect PGY 3s to start to think for themselves, to make more independent decisions. In fact, many of our PGY 2s start with that process towards the end of PGY 2. PGY 4 really is an acting attending year. As your role in chief year, you will act as an attending, running morning report, mentoring medical students, teaching junior residents, but there's also an opportunity for research. Here's our program in a nutshell. One gets to see rotations across the residency track in the scholar track. And you can see 16 weeks of neurology across the board and then medicine rotations. And our 16 weeks of neurology includes inpatient primary services, inpatient consultation services, as well as outpatient clinic. In your PGY 2 year, you can see on the left-hand side, we have the inpatient rotations of wards and consults, night float rotations, neurocritical care, epilepsy rotation, neuromuscular rotation when we go to a full complement of 8 residents across years, subspecialty clinic, and we have time for a PGY2 elective. We believe that's incredibly important, even though we provide exposure to a variety of subspecialties between 5 subspecialties in outpatient medicine, neuromuscular, epilepsy, neurocritical care, and stroke. We believe residents may want to use this time to hone in on a specific interest that may not be found in these rotations, or really to expand or deepen their interest in one of the rotations they've already rotated through. The PGY 3 year, residents will rotate through Washington Hospital Center's NIH stroke service. Consultation service become more prominent during the PGY 3 year. We have your first month of child neurology and a month of NIH, which is the hybrid rotation I spoke about. Night float. Then, of course, the remainder of the neuromuscular and epilepsy rotations. And I believe double exposure to this rotation is important because it builds on the skills you have learned during your PGY 2 year. Then again, clinic and an increased amount of elective time. During the PGY 4 year, you can see the chief rotation is one of the most important rotations, allowing you to act as an acting attending, mentoring medical students and junior residents. 2 months of child neurology, along with the next second month of NIH, 1 month of psychiatry, along with clinic and elective time to be able to really go across the breadth of neurology, gaining exposure in fields you may not have had time to, or really deepening your exposure, focusing on a research project if you're interested in doing a research project, or working on an academic project with your faculty mentor. If you look at the clinician scientist track, the rotations are identical, except the elective time has now been replaced by the NIH and research. The clinical scientist track group individuals will, of course, have exposure to all of the breadth of neurology that our scholar track individuals have, and their NIH time comes out of elective, and it is protected research time. You and your faculty mentor will decide how best to apportion your elective time during PGY 3 and 4 year. Individuals have taken the elective time all in one go, or they've parsed out elective time throughout the several years to be able to utilize that time when research is most active. Well, let's talk about call. We have a night float system at both of our main hospitals. Night float operates from Sunday night to Friday night, allowing there to be only Saturday 24-hour call at Georgetown, and then shifts of 12-hour calls at our MedStar Washington Hospital Center. During the weekdays, we have short call, which is a bridge between the day teams and the night float teams. And it's divided between the residents on that rotation that are on inpatient rotation. Approximately, if you're on an inpatient rotation, you take about 1 short call a week. Weekend call at Georgetown is a 24-hour call, and then 12 hours on Sunday with the night float taking over. Of course, we have a 4-hour weekend helper call as well to facilitate rounding through the services, both between the primary ward service and stroke service, and is divided between the PGY 2s and 3s that are on service. Washington Hospital Center, we have 3 shifts of 12-hour calls over the weekend, approximately 4 shifts a month divided between the residents that are on the inpatient teams at MedStar Washington Hospital Center. We do not have residents on call when they're on their clinic rotations, and very uncommonly do we have residents on call when they're on their elective rotations. We also have a disaster backup in case residents undergo an emergency. It's very easy to activate the disaster system by contacting your chief. We also have seniors on call, in-house short call at both of our hospitals because they're part of the inpatient teams. Chiefs take call after hours and overnight, and this is part of our graduated autonomy strategy, where chiefs become your first line of contact when you're on call to run a neurological presentation by them, allowing them to learn by hearing a presentation to discuss the issues that may need to be addressed, also to be able to understand the acuteness of it. And of course, an attending is also available if a chief is unable to discern what's going on, or if a PGY2 has a question that cannot be managed by a PGY4. They're of course available for in-house call as backup if needed. We believe it's incredibly important through our graduated autonomy strategy that our senior really is involved on service. They lead morning report cases. They actually will educate medical students and work with junior residents and mentor them. We also believe that senior residents should act as acting attendings. Many times they will lead rounds with the supervision of an attending, so they have the best of both worlds to be able to supervise junior residents, to be able to listen to presentations, create plans, but also have an attending as a backup should that need arise. Our seniors on service are definitely responsible for receiving phone calls and being able to discuss patient presentations. And in fact, we mandate that for the first 6 months of the residency program, every admission or consult is run through by a PGY4 so they can best guide our junior residents. Here's an example of our electives. We have electives across the breadth of neurology. One can see electives in multiple sclerosis, neuro-ophthalmology, headache, neuromuscular, movement disorders, cognitive disorders, neurocritical care, neurointervention, neurorehabilitation, and neuro-oncology, and even sleep medicine. And if you do not feel that this list of electives is exhaustive, we even have the opportunity to have a custom elective. Residents can custom create an elective with the time they have and be able to pick and choose. A popular custom elective has been the botulinum toxin clinic, which is often done in combination with movement disorders and the headache clinic. But residents can pick and choose a week of one rotation with another week of another rotation, or hybridize two different electives based on the geography of where they want to do their rotation. And they must approach our administration in the department to discuss what their plans are to be able to facilitate it. We can certainly help in creating a customized elective for our residents and maybe even reach out to different faculty to see how best to be able to fit that time in. Our academics go through a different variety of phases. We have morning report daily. We have at Washington Hospital Center, we have the case of the week. And at Georgetown, we have the case of the week on Wednesday. These cases are facilitated by our senior residents. In combination with junior residents, a case is presented, and a case is then dissected with a robust discussion of differential diagnosis as well as physical exam findings. We believe this traditional style of learning is helpful in individuals transitioning from going from medical students to residents and really becoming neurologists to think like neurologists and honing their neurological skill. We have protected didactic time on Tuesdays from 1:30 to 4:30. We have thematic lectures. So each week we have a theme of lectures that focuses on an aspect of neurology. Within that didactic time period is also monthly journal club and neuroanatomy. We have weekly grand rounds as well as stroke conferences and neurophysiology conferences as well. So there's an ample amount of learning opportunities from clinical cases to didactic lectures to discussion of specialty conferences. Our faculty includes 50 neurologists and growing number, and many of our neurologists are former residents of the program, and I think that speaks highly of our program and how we approach training. We represent a variety of different subspecialties in our program, and our faculty is really both educators and mentors. They mentor medical students, they will mentor junior residents and senior residents. They provide education in the form of didactics, as well as career guidance and bedside teaching. Our faculty is a combination of clinicians and researchers. We have an academic website that serves as a repository for all the articles and reading materials throughout the program. Some rotations come with dedicated reading materials, such as subspecialty clinic. Others provide suggested reading materials throughout the different journal articles. And we also have a repository of all of the handbooks that have been created by the residents as different QI projects to be able to serve as guide for future residents. We actively encourage scholarship in our program. We believe that residents should attend as many national and regional conferences as time allows or as their interest allows. Every year we have multiple residents that attend national conferences or regional conferences. Many of them will publish abstracts, and the department will provide sponsorship. We've also sent residents to multiple subspecialty education conferences, even in the virtual setting for headache, movement disorders, epilepsy, just to name a few. The program provides a stipend to support attendance of these conferences, especially if you are presenting an abstract at those conferences. Here's an example of residents attending the live conferences such as the AAN, the Movement Disorders meeting, as well as the ATMRD, which happened in Washington, D.C. You can see residents receiving hands-on instructions on how to utilize botulinum toxin and proudly displaying their publications. We believe that QI projects are one way to improve the residency program. QI projects can be initiated by the faculty or by residents or a combination of both. We almost always will have residents be mentored by faculty in creating a collaborative atmosphere of a QI project. Many times the guides are written by residents for residents. During our didactic topics, we always set aside some time for career guidance. We believe there's life beyond residency training and fellowship training. We focus on topics such as how to build a professional CV. We have a fellowship night that we just completed recently, where the breadth of neurology was represented by different fellowship directors to show different subspecialties to our residents, what a different subspecialty looks for, what career paths you have, and what each specialty offers. We also discuss understanding contracts so residents have a good idea of what a contract looks like before they go in to see their first job contract. We believe this is essential for residents to come out with these understandings of how to manage finances, contracts, selecting the right fellowship, being able to build the appropriate CV for not only just fellowship selection, but beyond this. Evaluations, of course, are performed by the attending on rotation, and residents meet with the program director twice a year to review those evaluations, to discuss their progress in the residency, and really to discuss their career plans. Residents also get the opportunity to evaluate the attendings on rotation when we have a town hall system that is there to discuss confidential issues or concerns that may arise during the course of the training. We believe that residents should have a life outside of training to make themselves, three-dimensional whole individuals. Residents will live either in Washington, D.C., typically close to either hospital or in between two, or living in Northern Virginia, Bethesda, or Chevy Chase, depending on their needs and if they're part of the NIH tract or if they're part of the clinical scholar tract. Our entire goal on residency life is to build not only a academic camaraderie, but also to build a social aspect of residency. The social aspect of residency is as important as learning neurology during the course of the 4 years. We want to foster a sense of community amongst our residents, but between our residents and our faculty as well. Here's an example of some of our residents at social gatherings, including the holiday brunch with the Secret Santa. We, of course, have multiple residents that get nominated for the String of Pearls Award, which is a teaching award given by medical students. And you can see our residents at various social happy hours that we do once a month at the end of our journal club lectures. We also have a wellness initiative. We believe it's important to focus on the wellness of trainees, and the better off trainees are, the better care that they deliver, the better learners they are. We address issues of stress and fatigue and time management. These are quarterly lectures given as part of the didactics. We also have those monthly resident happy hours that are the end of our journal club for the day. We, of course, have an annual brunch at my home. We also have a Secret Santa during that time period. And this year we started a new tradition, which is giving out awards done by residents to various faculty and co-residents. Here's an example of some of our wellness events, the holiday brunch. You can see, as well as our picnic that we held this year on the National Mall with the iconic Washington Monument. You can see our photos from our graduation this year, which was very celebrated because it was the first live graduation in several years. Our residents pursue fellowship. About 90% of them will pursue fellowship beyond residency, although we've had individuals go off to general neurology and private practice and academic practice. The goal of our program is to really create an independent thinking neurologist at the end of residency. If you choose to pursue a fellowship, we are here to guide you towards being the best potential fellow possible. If you choose to not pursue a fellowship, we are here to guide you in towards independent practice. Our former alumni include department chairman, residency, as well as fellowship directors. So we believe in neurology being your own path, whether it leads you down academic pathway or it leads you down research settings or even private practice, subspecialty, or general neurology. We can provide you the training that you would like to be able to customize your experience in residency to match your career goals. Here's a list of fellowships that we've seen over the last decade in our program. You can see a variety of fellowships, some very common fellowships such as stroke, as well as movement disorders and multiple sclerosis and epilepsy, but you can see some uncommon fellowships such as intraoperative monitoring, as well as fellowships such as neuro-ophthalmology and neuro-oncology. our residents have really pursued a wide variety of fellowships, and that speaks to the fact that we provide a wide variety of elective choices for residents really to find their niche and find their interest and deepen their interest. Washington, D.C., of course, is a phenomenal location to train. It is the national capital and a global city. We have excellent restaurants and a wonderful cultural scene. You can see in the photographs some of the beautiful monuments that are in Washington, D.C. We have world class museums such as the Smithsonian. And for a major city, we have something that's very unique and different from other major cities. We have nearby parks and ample green space. We have hiking trails throughout the city as well. We have easy access to most major cities across America by virtue of the fact that this is a seat of government. Here's an example of some of the photos of Washington, D.C. One can see the Smithsonian, the famous Watergate, the Kennedy Center, the Cherry Blossom Festival in Washington, D.C. You can also see Georgetown campus from across the Potomac, as well as the beautiful National Harbor. Of course, these are the folks that help administer the program. Myself, along with the collection of associate program directors and our program coordinator, Ms. DeLeon Mitchell. Thank you very much for your interest in our residency program and welcome. We look forward to seeing more of you on interviews and getting to know you better. Take care.